diagnoses and how you got here. Okay? So, what are your main diagnoses?
I have a traumatic brain injury. I have a spinal cord injury, C6, C7. I have neurogenic bowel bladder. I'm blind in my left eye and deaf in my right ear.
How did you get these diagnoses?
I got them into a car accident that happened around before.
Would you care to elaborate on that?
I was walking across the street with a family friend. A car stopped for me. Another car went around that car and hit me, and I severed my spine and cracked my skull.
Do you have any psych disorders?
I have PTSD. I have severe depression. That's really all I know of for now.
Out of all your diagnoses, which one stands out the most for you?
My PTSD and just my overall being having a disability. Just my overall appearance and being in a wheelchair.
How does this affect your day-to-day abilities? How does your disabilities affect your day-to-day life?
How would you think it would affect my day-to-day life?
Does it affect you as far as your friends go?
Yeah.
Do you have many friends?
No, I don't.
What about as far as your, you mentioned that you have a traumatic brain injury.
Yes.
With that, how does that bother you?
It bothers a lot of things, actually. It bothers, like, how I think and how I approach people. And whenever certain people say stuff to me or do certain stuff, I take it differently. And I say things differently than the average person. And it's hard.
Does it affect your memory?
Yes.
How so?
It affects my memory of what I said, what I did. The concept of time.
Do you lapse in time?
Yes.
Or do you forget what time frame you did what in?
I jumble it. So I put things that I might have done last year today, or I might have done it today and I remember it like it was something 6 months ago. So I jumble my time and what I did or what I've done up.
Being your mom, who's the interviewer, I can hear that you're agitated. Why are you agitated?
I just don't like talking about this stuff. It's not a very
Why are you doing that?
I do that whenever I start to get overstimulated.
Are you agitated right now?
Yes, a little bit, yeah.
What's agitating you?
Just the questions in general.
Do you not like to talk about your traumatic brain injury?
No, I don't.
Do you like to talk about your disabilities at all?
No, I don't.
Do you ever feel like in the future you'll overcome them?
No.
Due to your TBI, there's two questions that I want to ask you. With your TBI, do you have a hard time making career decisions about your furthering your career?
Yes.
Do you have an idea what you want your career to be like?
I want to be an actress and a scriptwriter.
when you say that, are you ready to do those things? Like, can you plan those things for your future?
No, I can't. Due to my TBI, that's something I mentally struggle with.
Due to your TBI, do you have a hard time making friends?
Didn't I just answer that?
Yes, but I want to. What about it makes it difficult to make friends?
Again, I'll slow it down. It's just the way I think, the way I comprehend things whenever I interact with people my age or anybody for that matter. The way I process things, the way I take things. Sometimes I take things too literal, and sometimes I shove it off. So it depends on really the concept of the conversation and who's talking to me. And sometimes I'm so open and honest with a person that it pushes them away, or I'm so mean to them that they don't want to deal with me. So sometimes I'm uncomfortably overpassionate. Like if I have a crush or someone or something to that effect, or I'm just extremely rude till you're like, well, dang. So it's either black or white. There's no gray area.
Do you like for people to have sympathy with you?
It depends on who it is and where it's coming from.
Do you feel bad whenever people try to help you or hold the door open for you or anything like that?
No.
How old are you?
I'm 17.
And how old was when you had your accident? What type of accident was it?
It was vehicle versus pedestrian.
Okay. And last question. How old were you when you had the accident?
I was 4.
Okay. Thank you for letting us interview you.
Hello. How are you today?
Oh, I'm okay.
I would like to ask you just a couple of questions about your patient. So the first question I have is, what types of behaviors related to traumatic brain injury have you experienced while taking care of your patient?
Well, I noticed that when she's trying to explain some thought or something, she's got a lot of difficulty in reasoning or concentrating on what I ask, or maybe saying what she thinks, her judgment. She also has a little bit of difficulty following a conversation.
Okay. And what do you do that works well when these behaviors arise?
I try to remember to slow down when I'm talking. That way I'm not too fast when I'm saying something. That way she can follow along with what we're trying to talk about. Sometimes I have to repeat myself, tell her again what I thought, what I was asking. And then I try to listen to her answer and praise her a lot, give her lots of praises.
Okay. Thank you so much.